I think it's about time to start. So, first of all, let me introduce myself. My name is José Jonay Ojeda. I work at the Hospital La Paz in Madrid. I am the quality manager of the hospital. I am the coordinator of this working group, the Quality and Safety Working Group of TransplantChild. Today's webinar is about the patient safety strategy that is a requisite, something that is established in the criteria for European reference networks, and that we have already in the plan of our network. And since this last year of the first 5 years of the networks, we plan to put it forward this year. As I mentioned, I am the coordinator of the working group, but the technical director is Dr. Lars Wemberg from the Karolinska University Hospital in Stockholm. And we also have in our working group a patient representative. In this case, Mr. Stefano Pavanello, that is the representative of the Association for Lung Transplant of Padua. As I mentioned before, just a brief introduction. Well, as you already know, European reference networks have been defined as virtual networks involving healthcare providers all across Europe. And as you already know, patients themselves don't have a direct relation to the networks. But as you already know from the criteria, when you apply for joining the networks, all the providers must disseminate information to patients and their families on patient safety standards, and also which safety measures they have in place in order to reduce or prevent errors. Therefore, according to these criteria, we must develop a patient safety program adapted to every network area of expertise. As it is settled down in those criteria, this program should include specific goals, procedures, standards, and process and outcomes indicators. And for example, some of the areas of focus this safety program plan can include are, for example, the delays in diagnosis, the disruption in continuity, the healthcare-related infections, the medication errors, the safe use of medication, or the safe surgical procedures, or the education and training around self-care and safety for patients. So, as I mentioned at the beginning, in order to facilitate this, the working group has included the development of a risk map in order to identify risks in the transplantation process. And as you may know, but we will try to explain in today's webinar, when we talk about risk management, that means that we will, through a methodology, we will try to detect, evaluate, prioritize, and treat all those risks through appropriate actions. So when we focus on those actions, and when we see what the healthcare providers that belong to the networks are doing in order to cope those risks that we have identified, we will be talking probably about safe practices that you may already have in place, and perhaps only a few we will not treat it. So we can share it together. We can treat it through this plan, or these patient safety plans that we are planning to do. And as we do also in all other aspects of the networks, we will try to display not only the safe practices that you may have in your centers in our website, in order so that all the members of the networks can take a look at them and see if they can be applied in other settings. But also we will try to put in our web all the work we will do about patient safety planning that we will talk about this afternoon. Well, just to remind that our area of expertise in TransplantChild includes specific items that we have to keep in mind. As you know, TransplantChild focus on pediatric transplantation, both solid organs and hematopoietic stem cell transplantation. And when we focus on this and on this aspect is because it's the only curative procedure for several rare diseases in children. As you already know, we talk about a cross-cutting approach, not only solid organ, but also hematopoietic stem cell transplantation. And in the whole transplantation process, we try to focus in all the aspects, the activities we do before transplant, the activities we do when the transplant is performed, and the healthcare activity that is related to this transplantation, and also all that process, usually in children before they go to the adult setting, that is post-transplantation, and when we take care of all the complications and all the aspects of care that can arise when transplant is done. So among others, for example, we talk in TransplantChild about the prevention, improvement of the surgical and preparative procedures, the prevention of complications and secondary diseases related to transplantation, and, for example, another example, the psychosocial care and education. Also to remember that in TransplantChild, we don't include the primary diseases or conditions in the pediatric patients that lead to or indicate the need of pediatric transplantation. That is included in all the others European reference networks. And we also don't include in our network the allocation of organs for the purpose of organ transplants, because there is a specific directive that regulate this aspect and is not included in our field of expertise. You may probably have seen this scheme before. It's about showing what we want when we talk about cross-cutting approach, several examples that we can work in our network. For example, as you can see in the pre-transplant, for example, beginning with the clinical assessment of the candidates, the donor and patient immunological assessment, or the selection and handling of the inoculum, even if it is a solid organ transplantation or a hematopoietic stem cell transplantation. Also, the surgical candidate selection. For example, some of the aspects that we are working on transplantation is on the advice on how to transplant with a multidisciplinary approach, the selection of conditioning of immunosuppressive regimens. You may have already know that for some time now we have been working on a clinical practice guideline around the use on immunosuppression agents. And well, that's one of the fields that we work in TransplantChild. And for example, in post-transplantation, as I mentioned before, the prevention of complications that are associated with the transplant. We used to say that the transplant is in fact a secondary disease that we induce on the patient. So well, that's the field of expertise of TransplantChild. And well, we can also focus on the diagnostic services in the post-transplantation, the therapeutical services, and the follow-up. Also, very important aspects that you already know and about the transition to adulthood that, well, can also be very important, not only from the scientific quality point of view, but also from the point of view of our patients and their family. Well, just to focus on two ways that we will use in order to work in this patient safety plan that we are planning to do. Just to remember that we can do it in a proactive way, or we can do it on a reactive way. For the proactive way, we are planning to do a TransplantChild risk map. That's what we are going to explain in the next slides. It will be an activity promoted by the Quality and Safety Working Group. of course, with the inputs of all the healthcare providers that belong to TransplantChild and representatives. But we have also to remember that in the last years, there's also a very important input for patient safety that is usually the possibility that professionals, in some cases also patients, can report adverse events that may be related to the patient safety. So that's a reactive way that most of the healthcare providers already have in place and that are analyzed and evaluate in order to detect if those events may provide opportunities not only in order to mitigate that event, that adverse event that may have happened to a patient, but also to prevent that it may happen again in the future. In this case, we are not planning to work in the adverse events reporting systems. Every healthcare provider, even at national level, there are specific rules and ways of manage these systems. And we propose that it remains at the level of the healthcare providers. And in this case, you may use your own experience in the management of these adverse events that are reported in order to put them or provide them to our network, to TransplantChild, and help us complete that risk map, that we are going to put forward. Just an example, when we are talking about a risk map, it's basically we have to define some aspects of risk that we may have detect, as I mentioned before, because maybe we have had some event that has been reported and that we have been aware of that risk through that, or maybe because due to the knowledge, and the advanced, the things that we already know about transplantation, we know that even if we don't have an adverse event, we know that we have to work on that risk in order to minimize the possibility that it can affect the patient's safety. In the slide, you can see one of these risks as an example. In this case, we have put as an example the increased rate of infections. That will be the risk description. But we have to think when we talk about a risk map also about which possible causes may have arisen or may have produced that risk. In this example, for example, the use of immunosuppressant medication, the existence of opportunistic microorganisms, or, for example, the possibility that these patients, when they come very often to the hospitals, they may have a chance not to get colonized or by these microorganisms that may produce later on an infection. Of course, when we talk about risks, it's not only about defining and identifying possible causes, but also potential consequences. As you already know, increased rate of infections may produce not only minor infections, but also potentially more serious infections, which may require hospital treatment. And probably one of the most important things when we talk about making a risk map is to think about every one of these risks, because maybe we have already, and probably most of the times, some defenses already in place. No, for example, we put in this slide, for example, the active immunization, the vaccines, for example, or the minimization of immunosuppression, the prophylaxis or the anticipated treatment, or even the education in infection preventive measures. As you already know, these are some of the defenses, the barriers that we already have in place and that help us control this risk. Well, there are several examples. For example, I mean, there are several ways of detecting this risk. As I mentioned before, we may already have those risks detected, no, in the everyday practice. But for example, you can detect them if you have an adverse events reporting system, no. And this is, for example, one of those an article that just gives or classify the adverse events that have been collected in this case in an American system. After we, as I mentioned before, we can identify as many risks as we think that it may be related to the pediatric transplantation. As I mentioned before, we will try to identify as many risks as possible, but following that cross-cutting approach, we will try to identify risk not only in transplantation, but also in pre-transplantation and post-transplantation. The following thing that we have to do is prioritize them, because as you may imagine, it can be a very long list. So this methodology suggests us that if we, for example, try to evaluate the risk severity of that risk or the risk probability, for example, combining these two factors, we can prioritize them. For example, if you see it on the slide that if we say that that risk can be a catastrophic event for the patient, or we say that it's very frequent, then we will have it on the top corner at the left. So it will be marked in red. That means that if we prioritize them with a risk matrix like this, all the events that may be classified in red will be the ones that we will focus. This is a way of helping us, as I mentioned before, through a standardized method to prioritize those risks and work and try to focus only on those that we decide that are more relevant. No, there can be several ways of prioritizing the risks. We will try to make it as simple as possible in order to help us discriminate among those risks. But well, as I mentioned, this is an example. And when we have those risks prioritized, then we have to think about what we have to do with that risk. No, as I mentioned before, if in that prioritization we evaluate it in a very high way, then we will probably try to avoid it, reduce it, or even transfer it. I mean, probably those risks that we think they are more important, we have in some way to tackle them, to treat them, as I mentioned before, with that possibilities. But if it's, on the other hand, it's on the green side of the risk matrix, then, for example, in that cases, in those events or those risks that we have identified, in those cases, the most convenient option is to accept them, or in some cases, reduce them, or mitigate them. So, as I mentioned, it's important to prioritize the risks that we have identified, but also it's important to, after we have decided that those are the risks that we are going to work on, to decide what is the best way to tackle them. Then, when we have those risks, we know what to do with them. Then the following step is to develop a plan in order to work with those risks and make that strategy that we talked about at the beginning of the webinar. In that cases, for every treated risk, I remember you that if we prioritize them, we don't have to treat all of them, but only the ones that are in the top part of the risk matrix. Then we must define specific actions and goals that we expect to get in order to mitigate, in order to suppress or in order to tackle, as I mentioned before, that risk, we have to also try to define beforehand what is which is the starting value of the indicators associated to that risk, what is the expected value of the indicators that we want to achieve according to the action and the goal that we think that can tackle the risk. What are the resources needed? It's good to have that also in mind before launching the plan. The expected dates for implementation and follow-up. It's very important that we establish beforehand, what are the dates that we expect that we may get, or we might get that goals. So we measure and see if that indicators are already on the expected value or not, and of course the follow-up. I mean, once we establish a plan in order to tackle those risks, we have to keep in the way, I mean, in the quantity of time, in the period that we decide is best, but we have to follow up them, in order to see if over the time it is under control or not. We have also to define which ones are the responsible for the implementation and the follow-up, and in case we have some procedures or some standards that can be from our own institutions, that can be national ones or can be from other scientific societies, but it's also interesting to have them associated to every risk we include into the plan. Just to mention, once we treat the risk and we measure the implementation, or whether it has been a success or not, then we will have to again go back to the risk metrics that we saw in the previous slide, and we will evaluate it again. In case we have achieved the goals expected, then in that evaluation of the risk that we did at the first time, it should be in less prioritization than before. So that's the idea. If we have the risk under control, then in the following evaluations that we will do over the time, there will be other risks that will be, in that case, in the first places, and those will be the risks that we will tackle, but not this one if it's under control. Lastly, but not last, of course, evaluation, it's also a key point when we talk about a patient safety plan. As I mentioned before, we have to regularly evaluate what are the effects or the actions and the objectives that we have settled. And this is a continuous improvement. I mean, as I mentioned before, I mean, if there is effect on the actions that we have provided and the indicators improve, then that risk will be under control. But we will have to be very careful that we continue to follow up that indicator, to follow up that risk in case we need the evaluation changes all over the time, and we have to look into that again. The idea is that you may have safe practices already in your centers, but according to this methodology, and when we evaluate the risks, we will be able to detect if there are other safe practices in place, and we want to collect them all together, so all the centers, all the healthcare providers can have them accessible in order to learn from them. And that's the idea, to have safe practices repository for all the network. And just to describe which will be the following steps that we will be promoting from the network, it's, we ask you that you can identify in your healthcare provider what are the most relevant reported events in relation to patient safety in our setting, in pediatric transplantation and within the scope of TransplantChild. We ask you also to identify patient safety risks related to those reported events and others that you may have already under control through existing procedures already in place in your centers. We plan to collect all these risks that you may have identified. We also plan to collect them also from asking feedback to the patients' associations that already work with TransplantChild and other stakeholders, because we want to put together this risk map that we have shown you, and that will be the initial steps of this patient safety plan that will be focused on the pediatric transplantation in Europe. As I mentioned before, we plan also to collect all the safe practices that you may have already in place, or the ones that will be produced according to this plan, because we want them to be shared and displayed in our TransplantChild website. And well, that's the last slide. And well, if you want to, we can. You have any question or query, please, this is the moment, and I will be very eager to answer all the questions that you may have. Thank you very much. So if any of you want to ask anything about, maybe you already know some of the patient safety methodology, because in your centers you already have work with them, or you may not, but you feel curious to ask anything about that? You can also use the chat. Let me see if there's. Well, I understand that there may be no questions now, but please do contact us in case you want to get more information of this activity of the Quality and Safety Working Group. Dr. Wember or myself will be delighted to answer you and put forward this activity that we have planned for the network. Thank you very much. Thank you.